The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Ciarra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here. Hello, everyone. Today I have Maxine Eiland back with me. She is the Divine Mama Strength owner here in Austin, Texas. And she talked with us before. She was here to talk about bounce back culture and kind of not getting your groove back. But I like to say silly things. So we'll say getting your groove back if you're trying to get back into shape and into the gym. But today we're going to talk about something a little different. And we're going to talk about estrogen and hormones and aging. Oh my, I'm doing that. I'm 40, you guys, now. So thank you so much for being here with me today, Maxine.
Thank you for having me. I'm excited to be back and talk about this.
Yeah, me too. And I really think that it's something that a lot of us don't know about because, surprise, women don't know much about their bodies because we weren't taught much early on in life, right? We barely knew what our own period was when we got it, at least some of us. So I would love for you to just start out by explaining what estrogen is. We all know we have it. We know it's like the female hormone, but what is it and what role does it play in the body?
Yeah, so I think to your point, right? Estrogen is something, it's a hormone, right? It's a hormone that runs so much of our body. But when we think about estrogen, we think it only as a reproductive thing, right? Or how it ties to maybe birth control if we're even well-versed in that. But in reality, right, estrogen is so much more. It's a hormone that can do so many positive things for us. But once we start kind of losing that estrogen, it starts affecting things like our brain health. It can decrease our muscle mass, bone density, all those big things that become really, really key as we move forward in life. And so, it can affect metabolism, insulin. So I think when we're looking at the estrogen kind of life cycle, right, and as we're kind of aging and getting a little bit older, right, our estrogen starts dipping. And so then we start seeing other things start to get affected by that, right? And we don't necessarily know that because we don't necessarily get taught that anywhere.
Yeah. What kind of things would be a sign for you? Tell me what my signs are. What would be a sign that we are starting to have our natural estrogen decline? And when around does that happen? Or is there like a certain range where it's typical?
Yeah. So you'll start kind of seeing some dips in your estrogen anywhere as early as your late 20s to your early 30s.
Oh, wow. That's earlier than I thought.
I know it is, right? And it's, I'm 41. So I had no idea when I was like, a couple of years ago when I was really getting into this world and this, this space and really understanding women's wellness. I was like, wait, what? And that explains so much, right?
I feel bamboozled.
Yeah. And I mean, and honestly, like some people lose it so many different phases of your life, right? But it's not an abrupt kind of shut off in your, from one day to the other, you lose all your estrogen. That's just not how it works. But you slowly start seeing a dip, right? Somewhere around your 30s, your early 30s. And then from there, right, you'll start seeing maybe some other symptoms as you get closer to your 40s. And that's where you hear that perimenopause, right? And that kind of,
I think I'm doing that right now. I came home to my husband the other day after seeing one of my friends. And I said, honey, I have something I'm going to tell you. I'm going to tell you, and then we're not going to talk about it. And I just had like a really straight face. And he's like, what? And I said, all right, I'm going to say it one time and then that's it. And he goes, okay. I said, I think I'm in perimenopause and I don't want to talk. I said, I don't want to talk about it. And I walked away because I was just being silly. But I was like, I think that I just have to come to terms with it now. So what are some of those physiological signs that show up in people that might be a signal that that's happening for them?
Yeah. So I think you hear things, the common ones like brain fog, right? Oh, I'm forgetting things, or hot flashes, right? Like those are the things. Growing up, my mom would be like, "I'm so hot," and so then that was my mom going through quote unquote menopause, but really she was
Yeah, I
going through
always thought,
perimenopause.
yeah, I always thought that was just menopause. I guess I didn't
Yeah.
realize that they were separate before I started entering it.
So menopause is actually 365. It's one day, by the way, and it's considered to be 365 days from the date of your last period.
Whoa.
So that's how doctors clinically kind of say that's your menopause, right? And then it's that one day, and then after that, you're postmenopausal.
Weird.
And yeah, I know, right?
One
It's like
day.
perimenopause, postmenopausal, kind of phases of life.
Always learning something. And there are women that will be listening to this that are similar to me. So I personally don't have a period. So there was no, 365 days from my last period. I have no idea when that was. So I don't have that mile marker to go, oh, okay, which is hard because I just don't have a uterus, but I have ovaries. I'm still making
exactly.
estrogen and the hormones. So that's really, really interesting. So brain fog, I feel like all postpartum moms even have that. Right? Freaking all of us women have brain fog,
that's
right?
The thing. Like so personally, I felt a lot of these postmenopausal symptoms 2.5 years, like probably 2 to 2.5 years after I had my daughter, my second. So for me, I was like, is this postpartum still? Like, am I going back to like this feeling, or is this more perimenopause? And then in talking to my doctor, right, we kind of discovered that was, I kind of was starting perimenopause, which by the way, if you have children later in your late 30s, early 40s, you can actually kickstart perimenopause a little bit too, because your hormones are all over the place, right? When we're having a baby. So then your hormones might not regulate back to that original state because of all the fluctuations of what happened during your pregnancy. So that is something that some women have reported as being a thing. And I kind of think that might have been something that happened to me. But so that's aside, just a fun fact about it. But,
yeah, this is so interesting.
But there's so much to talk about, by the way, on this subject. So the other thing I was going to mention, kind of going back to the symptoms, though, there's some wild symptoms. Like you can start losing teeth as part of perimenopause.
Stop it.
You're
going to be nightmares.
Because your gums, because estrogen is one of the things that, can really support your gum health and all that stuff. So like your gums can start getting kind of weakened, and then you can start losing teeth.
Oh my God. People on YouTube, you can see my face. I am mortified. Like, this is terrifying.
Yeah. I mean, did you see that woman on Instagram when she was like steaming from her head?
No.
That's how oh my gosh, I have to send you that video. Yeah. Wild. That was she was having severe symptoms.
Oh my gosh.
I know. And then another really strange fact about this too, which I think is that 2/3 of Alzheimer's are women. That Alzheimer patients are women, and it's tied to the lack of estrogen.
Oh, wow.
Yeah. So there's all these really, really strong benefits in
this makes you even more want to okay, we do need to do something about it. Okay, how do we fix it? Because that's terrifying.
And by the way, that's not going to solve everything, right? If you have a history of, genetics of Alzheimer's running through the family, like all those things, right? There are some things that we just can't avoid, right? But it's not going to, it might deter it, right? If that's
or if you didn't have family history or whatever, then maybe that is something that could help. Okay, that's really interesting.
I love that statistic about the Alzheimer's, and then the teeth is really fascinating. I think it's there's a statistic that's 30% of women lose a tooth the first 5 years of menopause. Perimenopause. Yeah.
You guys, I should have put a trigger warning at the beginning of this.
I know, right? And this is not this does not happen to everybody. And it's just random things like that will happen.
It's also probably something people don't talk about, because who wants to talk about, hey, I just lost
if you lose a tooth, you're just oh, I lost a tooth,
Also, I mean, the more to me, that would be embarrassing to lose a tooth. I would be oh my God, I've got to go get it a fake one put in there right now. And so that could be something that people just don't share about because we don't want to. So what can we do about it?
So you can get added estrogen, right? So there is a difference between estrogen that you can find in birth control pills versus estrogen that is part of hormone replacement therapy. So estrogen that's in hormone replacement therapy is estradiol. I think that's how you say it. And that's it's basically mimicked what natural estrogen is. So how it affects your body is completely different versus something that's in a birth control pill, where that's a little bit more chemically, and with the pill in general, it kind of goes through the liver. So then it can cause some issues there as well later down the line. That's
So
just a
how do
general
they
birth
do
control thing.
HRT
So
if it's not
HRT
a
has a
pill?
few different ways, right? You can get it as a pill, and it works for certain people, and there's that's totally fine. You can get it as a patch, and you can get it as a cream or a gel. And the patch is the most effective because of the way your body absorbs the estrogen. So that's something to consider when you're kind of doing things. Of course, if you have toddlers running around and they might yank your patch off or something like that, maybe a cream is better, right?
They would.
I know, right? There's also a vaginal one, a vaginal cream that you can put on that's just estrogen for your vagina, and that is specifically if you start having dryness. And so that will specifically only help with the vaginal kind of like dryness that you might have as estrogen, because that might be the only big symptom you have, right?
I also want to point out here, I actually recently saw somebody share in a mom group, and she's somebody that I know that has been through, she had breast cancer, and she saw a bunch of women, because you know what we do in these mom groups, we like ask for recommendations for things. And someone was talking about hormone replacement therapy or HRT and was like, you know, where did you guys go? Who did you see? Who should I go to? And she just chimed in and said, do whatever you're going to do, but I would really recommend getting a test first to see if you are a carrier of, I think it's called the BRCA gene, in order to see if you are at higher risk of breast cancer, because getting estrogen therapy, you know, HRT could actually like boost your cancer cells if you were already somebody that was like predisposed to getting that. Is that something you've heard too?
Yes. Absolutely. So I think if you, again, and that goes back to, I have a history of this or, you know, whatnot, definitely make sure, again, this is why I'm not a doctor, right? I'm just trying to help educate. And so I think when we, you know, we start having these conversations with our doctor, that's important, right? Do I have a history of, you know, breast cancer, of heart disease, which is the number one killer of women, by the way. And also Alzheimer's, and they'll be able to kind of help. Like if you have a really good doctor, they're going to be able to help advise, like, these are the things we want to do before we put you on estrogen. If you are taking estrogen and you still have your, like you mentioned, right? You didn't have, you have your ovaries, but not your uterus.
Yeah.
So if you are in your case, right, you can just take estrogen, right? If you're still having, you know, your periods and all that stuff. If you're still having your periods, you're going to have to add in progesterone into that as well, right? So you can't just take estrogen without progesterone added in.
So kind of people that do have their uterus have to take a combination.
Yes.
Gotcha.
Yeah. So that's, and again, doctors will be able to tell you that, right? Because that's part of what their protocol is, right? They understand those things. So it's just all caveats, right? Like there's so many benefits to it for the majority of women, but there's always going to be a percentage of women that, you know, need to talk to their doctors about those very specific cases, right?
Yeah. And there's a lot of people that are kind of afraid of this hormone replacement therapy because of past studies and things that have been done. And I heard like there was some women's health initiative or something, and there was findings about it. Do you know about this? Is this something that's in your wheelhouse?
Yeah. And that's where I absolutely recommend this book.
Oh, I just happen to have it handy. Matters. She pulled it up.
So this book is kind of like what they say is the Bible of estrogen now today. So, and there's a great podcast and stuff too associated with this, where they talk a lot about estrogen as well. And there's great doctors and things that have done tons of research. And you might have seen like some of the documentaries that have come out and things lately about that. But the Women's Health Initiative, they did a report. I forget what year it was. It was probably the 80s, because things were wild in the 80s. But they did a report, and really the sample size that they took, that was the biggest problem. So the sampling of women that they used, one, wasn't enough of like what you would call like statistically significant, right? To be able to say one way or another of something. So they rushed to kind of put this report out. They used women that were already in menopause, and then had them kind of, you know, take estrogen. And then we saw an increase in breast cancer with that stuff, and heart disease. So you actually saw the adverse, right? So if you've already gone through menopause and you're kind of in that postmenopausal stage, taking estrogen might not be the right fit for you, right? Oh. So what we want to do is try to capture it prior to your menopause date, because that's the time period when you can get that most impact from it. And it becomes preventative post-menopausal. So that report came out. It was very fear-mongering for women, and doctors stopped giving HRT to women and stopped giving estrogen. There are women out there today that were on it originally. They were around when this report came in. Their doctors stopped them, and then now it's become a completely different, mindset around estrogen and hormone replacement therapy. And they got, a little bit of the short end of the stick there, right? Because they could have had maybe some things more positively now than they do today, right? Because that's just where research comes in, where you have to really, really make sure the data that you're doing is quality data and you're actually looking at all the right pieces of that data.
I even, in my doula training, I even teach people about like how to look at research and to see if this is like, there are retrospective studies and like there's all sorts of different types of studies, double blind, not, all of these.
Yeah.
And it really does impact the quality of the data, but it doesn't matter. Like the damage is done if somebody hears something and they just
anything negative, right? You're like, nope, can't do that, right? And I love this book because this book is so research driven. So there's research reports that it pulls from all over the world. So it's not just the United States, right? It's the UK and Australia and just all these really great countries that have actually done a lot of research themselves. And they've also have these great case studies that they've focused on that they share out and stuff. So it's very, very data driven. It's very, very research heavy. I wouldn't recommend reading it at like 11 p.m. at night after you've had to deal with your kids all day because you might fall asleep. But it's that heavy in the data world. But it's a great book to really get some really great background about estrogen and kind of like whether or not it might make sense for you.
So if you dumb it down for me, like if somebody's listening to this and they haven't had their last period yet, or let's say they haven't reached the post 1 year mark of having their last period, because then it may not be as applicable to them. But where is that sweet spot? What if somebody's before the sweet spot? What would they be looking for to go, oh, this is when I should be going to a provider and seeing if this would be helpful for me?
Yeah, so I think symptoms are the biggest thing. And it's not like your tooth falling out necessarily. There's probably some others more.
I hope there's something else more subtle first.
Yeah, there's definitely more subtle ones, right? Where it's just from like one day to the next, right? You're noticing just your body doesn't feel like it's able to handle things in the same way, right? Now, whether that be temperature, mood, you suddenly find yourself maybe a little more depressed, like a little bit more depressive. The brain fog and the memory, right? Like that's a big one. The sweating, like
birth workers, I'm sorry for you because we always are like this. We're like, are we recovering from a birth or are we perimenopausal? I'm not sure. Says the girl who woke up at 7 a.m. this morning or got to go to bed at 7 a.m. this morning from going. But the night sweats thing is so true because I wake up almost every night now, and I never used to do this, between 3 and 4 a.m. And I have a little Nest app on my phone for my thing, and I turn it down 1 degree between 3. I need to it's smarter than me. I could just set it to do that. I'm sweating in the middle of the night between 3 and I'm always cold, y'all. So I'm actually turning an air conditioner being turned down in this house by Ciarra Morgan is like a sign of the apocalypse. My husband's like, what's going on? Are we allowed to turn on the fan now? Is that a thing? Do we get to turn on the fan? Because I've always been anti-fan. And that was my first sign that something was up. I'm like, I've never woken up because I'm hot.
Yeah. And I'll say, your smartwatches and things have ways to they monitor your temperature. Some of them do. And for me personally, the biggest thing that I was like, wait, something's just not right anymore, is I was losing gobs of hair. And I didn't have that problem postpartum. And I'm telling you, like 2 years postpartum, I would be in the shower and I would just have like gobs of hair coming out when I would be, washing my hair, to the point where my son was like, oh, look, I'm playing with mommy's hair. It's like a web,
I've always had that.
Wrong,
I've always had that before I would have probably been perimenopausal because I still had my period. And don't some people still spot after they don't have their period anymore? So it would just be after the full, like once your period is not your normal period anymore, I guess.
Yeah.
Okay.
And even just like even some of the spotting, right? But then other things can cause spotting too, right? So it's kind of like, when you actually feel like that was a full period, right?
Do you not feel like this is like every other women's issue where we're like, and so we're just not sure.
And I mean, it's
so
true,
it's going to look
like,
different for everybody. Sorry.
It looks different for everybody. And, I think the most important thing to kind of really think about is, you know, your body best, better than anyone else. And if something feels very different than it did, say, a week ago or a month ago, there might be something to consider there, right? And then kind of retrace your steps. Like, am I just losing sleep because, you know, the baby had a sleep regression? Or am I losing sleep because I'm stressed out, right?
Yeah.
All of those things can also affect your sleep, right? And so those are things to kind of consider, right? Like all of these environmental things affect you and your body and your hormones and how it handles things, right? So it's kind of a web in and of itself, right? So if one thing is weakened, then everything else is going to also become weakened by it.
Yeah. So what are some of the, like, if you wanted big takeaways for people to remember, what are like some of the really big benefits and some of the risks that people should know before considering something like this?
Yeah. So I would say biggest benefits, right, are if you're seeing these symptoms come up that are things that you didn't have before, estrogen might be something to consider, right? Talk to your doctor about it and let's kind of see if that's something that makes the best sense for you. And then that's where you caveat things with like, okay, do I have a history of some kind of like, you know, breast cancer, Alzheimer's, heart disease, any big, you know, major things from a health perspective that is genetic. Those are things to then bring up to your doctor as well, if you haven't already, and see if what makes the most sense, right, to help. So I think, you know, those are, I would say, the bigger takeaways from like a pro and a con, right? Like, I think I have 3 older sisters. My oldest sister is 10 years older than me. So we are in very different life stages all the time. So, you know, she's kind of nearing that like menopausal state, right? And, you know, we've talked a lot about estrogen over the past couple of years. And one of the things she asked me was, well, why would I need to take estrogen? If my body's losing estrogen and it's depleting it, like, isn't that normal? Like, why would I need to add that into, you know, take that as a, you know, a pill or a patch or something? And my response to her was, you don't have to, right? You absolutely don't have to. But if you can figure out a way or you find something that minimizes some of the things that you're feeling every day, like make you a little sharper in the brain,
Why
or
not?
make you not sweat so much at night, or make you not lose so much hair and not feel like you're baldy. Why not do it? Right.
That's kind of how my thought process works for a lot of things. I'm like, people, a lot
It's
of
like
times, like,
Botox.
if our bodies were made this way, why not just keep it? I mean, I have
Right.
people that all the way from the beginning of the child's life are saying if our bodies weren't made with enough vitamin K in it until day 8 to clot blood efficiently, then why are we replacing it? Surely it was made that way for a reason. There are those
Yeah.
people that think that way. And then I'm like, yeah, but if sometimes we can beat science, like for this,
Mhm.
sometimes we can, not science, sometimes we can beat genetics and
Yeah.
just the
Like, why
normal
not?
life process. And so if we can feel a little bit better along the way and it doesn't have too many negative side effects, or we know that for us, those risk factors aren't as big, then it could just be something that improves quality of life for some
Exactly.
people. And I do have a question for you. And you can say, Ciarra, I don't know this answer. And this is not what we were here to talk about today. And that's okay. No, guys, I did not prepare her or tell her as an asses. But when I also hear HRT, I hear it a lot of times. I know women that are taking testosterone supplements.
Yeah.
Is that also considered HRT? And is that like, doesn't that seem opposite? Because estrogen and testosterone are like opposite hormones in my brain because one's the male and one's the female
Yeah.
hormone.
So every woman has testosterone as well. Testosterone is also a hormone. Men obviously have a higher percentage of testosterone. Some people don't prescribe testosterone for women, but there has been proven facts in the testosterone phase, I believe, that really give you some positives. Like I have personal friends that have taken testosterone and they've
Me
seen
too.
huge improvements where they weren't seeing that with anything else, right? Their body was responding better with having added testosterone given to them. And when I say testosterone, it is like point,
Tiny bit.
0.05 or something, we
Yeah.
don't need that much more to give us maybe a little bit of that extra like feeling of ourself again. And there's mixed things about testosterone too. You'll see some doctors are for it, some are against it, but I think it's really just understanding how your body is. You can get a testosterone test done, and to see like what your levels are there too.
And just like
And
with
so I think
anything, some people's levels are going to be higher on some
exactly.
things than others. My friend so I'm 40, I think she's 55. She is on these supplements where she gets these little pellets put in her butt cheek.
Yeah.
And she's so open about it. And you can always tell when she got it done because it wears off over time. I'm
Mhm.
like, you got your butt pellets in, didn't you? I kind of like joked with her about it. And she's like, sure did. She's so much happier and like energetic. And she's like, I can keep up with my husband.
I mean,
so happy when after she gets hers.
And exactly. And so again, it goes back to that. If you can have a better quality of life, why would you not? Right. I mean, you think about how our ancestors, in some cases, right, they were not living maybe the most active of lifestyles. And now we know so much more now, right? Strength training obviously is a big part of that, where we're just like, come on, everybody should be strength training, some capacity.
Like, I wouldn't be able to still build muscle. And if I'm not able to, because my hormones are, especially if that's part of your mental health and being strong is like part of your identity for some people. Then if your muscle mass is not being able to be what it was before, then that would be really mentally also upsetting for you. You said the thing about the book called Estrogen Matters, and you mentioned a podcast. Do you remember the name of that, or can you at least message me that so I can add it in the show notes? Because people might want to listen to that.
Okay. I don't know exactly. Yeah, it's around the Estrogen Matters book, but I'll get you the exact
We'll find
name.
it and we'll put it in the show notes for those of you listening, because I know I want to go listen to it. I'm always up for a new podcast.
Oh, yeah.
So is there anything that we missed that you wanted to make sure you mentioned today about this, other than how people can find you?
I think for me, the biggest takeaway that I have with this is that we don't have enough research really surrounding a lot of women's health, right? And so I think over the course of the past few years, that's becoming more and more prominent, right? We're learning more about what's happening with us. We're learning more about hormones. But doctors were not exactly taught a lot of this stuff in their schooling, right? And a lot of doctors are very open about that. And so I think if you try to bring up this stuff with your doctor, and your doctor is a good supporter of you trying to understand your health and your wellness a little bit more, and they're not necessarily the right person for it, they should be able to help refer you to somebody there is. And there's some great, great people, I think, in Austin and stuff that can help out with that as well. And I can send you some of those resources as well.
Sure, yeah.
That would be helpful for some. But yeah, so I think finding the right doctor to help support you and understanding your body is really, really pivotal, because this phase of our life is already such a huge transition. And so again, going back to the quality of life thing, like why would we not want to make our life a little bit more, enjoyable?
Especially those of us who are having children, especially for those who are having children later, because I work with, as a birth doula, I work with a lot of parents of all different ages, but I would say the majority of my clients are over 35. And they are, like you said, sometimes that can push you into perimenopause because of all of the wild hormone fluctuations. And one of the worries that a lot of them have is, I'm okay with having children later, but I'm a little bit worried about how I'm going to be able to keep up with my kids as they grow. Like when they're 10 and we're going to football practice and then to soccer and they want to do all of the things, I'm just worried that I won't be able to keep up. And things like this help us be able to still feel like, we got a little bit of youth in us sometimes.
A little pep in us. I mean, I don't know if you know this, but the Golden Girls were 40.
I can't. I really can't with that. And I'm personally offended because in my head, they were 80.
I know, right? And then how old was Sophia?
Right. 80 also. That really is mind-boggling.
Blows my mind. I know. How they used to depict women too was completely different. I don't know. Part of it, I don't think the hairstyles were giving us very much, in a positive light there.
Yeah, back then for sure. Well, if somebody wanted to reach out to you and talk with you about this and just even get your guidance or learn more about you, how can they do that? And I'll add it in the show notes as well.
Yeah, you can go to divinemamastrength.com and also my Instagram and Facebook at Divine Mama Strength are great resources too. I usually have a lot of, posts and things that are kind of, some of them are around this topic as well. Just because I want women to understand some things and ask questions, right? Just ask questions. That's all. When you're in the doctor's office, right?
Awesome. Thank you so much. I really appreciate it.
Thank you.
Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.